like to introduce the acting leader of the Australian Greens, Senator Richard D. Natale, a GP from a former life, who's going to come and speak to us now. Richard.
Thanks very much, and thank you to all of you for coming along, because you're here today for one reason and one reason only. You're here to protect and defend what is one of this country's greatest institutions. And what we're witnessing here at the moment is one of the biggest attacks on Medicare since it was developed in the late 1980s. Make no mistake, this goes straight to the heart of what Medicare is about. Because Medicare is based on the principle of universality. What that means is it doesn't matter if you're rich or poor, it doesn't matter if you're unlucky enough to be born with a genetic disease, if you've got a couple of kids with asthma, if you develop a kidney infection later in life, if you've got diabetes and you need to go and visit the ophthalmologist, the kidney specialist, the optometrist. It doesn't matter, because we've got a health system that will look after you. And the Abbott government is trying to tear it down. This is an attack on Medicare. And why is the Abbott government trying to tear it down? You're going to hear a lot about the health system being unsustainable, unaffordable, and it's nonsense. This is ideology, pure and simple. This is a government that has never supported universal health care and will do everything they can to tear it down. Just look at how much we spend on healthcare in this country. You'll hear about how costs are spiralling out of control. We spend about 9% of our GDP on healthcare. You look at where Abbott and co are trying to take us, to the US system, a two-tiered system where one level of healthcare is provided to those who can afford it, and it's a good level of healthcare, and a second-rate level or no healthcare at all for those people who can't afford it. And they spend twice what we do as a proportion of their GDP on health. They spend about 18%. It's unfair, inefficient, unaffordable and stupid to go down the US track. So don't believe for a moment that we can't afford to look after ordinary Australian citizens who need healthcare. We can and we should. Costs aren't spiralling out of control. After all, what is the point of economic growth if we can't spend money on healthcare? Why should we grow our budget if we can't spend money on the things in life that matter? So our health system is sustainable, it's affordable and it's efficient. But Tony Abbott's scheme for co-payments, it'll have an impact, just not the impact that Tony Abbott and Minister Dutton think it will. Some people will decide to go to a doctor and some of them won't need to go to a doctor. That's true. But the cost is the young child at home with uncontrolled asthma who's been to the doctors 3 times that week, who's been to the pharmacist to get their asthma medication, who's struggling to pay the bills, might not go that next time and find themselves in an ambulance in intensive care because they didn't see their GP. That's the cost. Or the man at home who's got chest pain and he's again struggling and decides maybe it's just a pulled muscle. 3 days later, he's in an ambulance having a heart attack and on life support. That's the cost of co-payments. And that's where this government is taking us. That's where this government is taking us. Now we have an opportunity. The door is always open. We will talk to Minister Dutton and to Tony Abbott about where savings can be made and revenues can be increased. Why should we be giving the big end of town, the fossil fuel lobby, billions of dollars in subsidies? Why should we be doing that? Why should we be tearing down the Clean Energy Finance Corporation, which is saving the planet and making money? Why should we do that? Why are we deciding to balance the books on the health of the most vulnerable Australians? And it's those people whose health is worse, those people on low incomes, who will be the ones who decide not to visit their doctor. So this is an attack on vulnerable Australians and it needs to be stopped. Of course there's some areas in healthcare we can look at. We should be investing more in looking after people in the community. rather than sending people to hospital where they're more likely to get even sicker in some instances and where their care is going to be much more expensive. We should look at the PBS and look at ways of making our drugs even more affordable and cheaper to the taxpayer. We could look at health technologies and look at some of the things that we're funding at the moment that aren't based on good evidence. There are many areas where we can make more efficiencies in the health system and improve the patient experience, but instead this government is intent on fighting a 30-year-old ideological battle, using the guise of balancing the books, sacrificing the healthcare of ordinary Australians. Why? Because it's never supported Medicare, it still doesn't, and it wants to tear it down. Well, you're here today because you want to build it up. We want to build up Medicare, we don't want to tear it down, and today starts that campaign, not to tear down Medicare, but to build it up, to defend it, and to extend it.